Hello, future doctors and nurses. Today's topic is one of the most critical emergencies in medicine: shock. This condition can mean the difference between life and death, and as medical professionals, you must master it inside out. So, let's dive deep into what shock is, its types, stages, hidden truths, and what to do and not to do when facing a patient in shock. In simple terms, shock is not about fear or surprise. In medicine, shock is a state of inadequate tissue perfusion leading to cellular and organ dysfunction. Put simply, the cells of the body are not getting enough oxygen and nutrients, and this can rapidly progress to multi-organ failure if not treated. There are 4 major types of shock, and each has its own cause and treatment approach. 1. Hypovolemic shock due to blood or fluid loss. Causes: trauma, bleeding, dehydration, burns. Clue: weak, rapid pulse, low BP, cold, clammy skin. 2. Cardiogenic shock due to pump failure of the heart. Causes: myocardial infarction, arrhythmias, cardiomyopathy. Clue: hypotension, chest pain, pulmonary edema, distended neck veins. 3. Distributive shock due to abnormal vasodilation and maldistribution of blood subtypes. Septic shock, severe infection. Anaphylactic shock, severe allergy. Neurogenic shock, spinal cord injury, brain trauma. 4. Obstructive shock due to obstruction of blood flow. Causes: pulmonary embolism, cardiac tamponade, tension, pneumothorax. Clue: sudden collapse, distended neck veins, absent breath sounds, if pneumothorax. Shock is not instant, it progresses through stages. Understanding these stages helps in early recognition and saving lives. 1. Initial stage, cellular hypoxia begins, but body compensates. Patient may appear normal or just slightly anxious. 2. Compensatory stage, body activates sympathetic nervous system. Signs: tachycardia, tachypnea, cool clammy skin, decreased urine output. Hidden truth: at this stage, shock is reversible if treated quickly. 3. Progressive stage, compensatory mechanisms fail. Metabolic acidosis, hypotension, confusion, weak pulses. Organs start shutting down one by one. 4. Irreversible stage, severe organ damage, multi-organ failure. Even if patient is resuscitated, survival chances are very low. Now let me share some hidden truths that textbooks often don't emphasize enough. Shock can be occult. Patients may look stable initially. Always check capillary refill, urine output, and mental status. BP is a late sign. Don't wait for blood pressure to drop. By then, shock is advanced. In septic shock, warm skin in early stage can mislead you. Not all shock means cold, clammy skin. Giving fluids blindly in cardiogenic shock can kill the patient. Know your type before management. Identify and treat the underlying cause immediately. Give oxygen. Every shock patient is hypoxic. Establish IV access with large bore cannulas. Start fluid resuscitation in hypovolemic and distributive shock. Monitor urine output as a marker of tissue perfusion. Call for help early. Shock needs a team approach. Don't delay treatment waiting for all investigations. Don't give large fluid boluses in cardiogenic or obstructive shock. Don't miss hidden bleeding, retroperitoneal, internal. Don't ignore mental status changes. Confusion may be the first sign of cerebral hypoperfusion. So, that's shock. A life-threatening emergency with multiple faces. As future healthcare professionals, your sharp recognition and quick action can truly make the difference between life and death. If you found this helpful, don't forget to like, share, and subscribe. And remember, in shock, seconds count, so always act fast and act smart. See you in the next lesson.